Hello, guys. So, there's this thing that is very common in this age and time, which is sharing medications with your friends, your families, your relatives, because they're having a similar symptoms to what you have felt or what you have had in the past. Does not give you the right to give them the medications you have used before. If the person is not a doctor, a pharmacist, you understand, they don't have the right to be prescribing medications for you. And you also don't have the right to be collecting the medications from them, because your symptoms is similar to what they have had does not mean you should collect that medication from them. You have the right to take charge of your health by consulting a professional, a doctor, or a pharmacist. You understand? So stop collecting medications from your family and friends because they feel like the drug will work for you too. What they don't know is that the symptoms you are having might be an indication of a very major illness or damage in your body. You understand? So this is more reason why you should not even collect medications from them. And again, you just collect the medications, you don't check whether it has expired or not, because they've had the drug at home for a while now. You understand? So you just collect it, you just use it. You don't check the expiry, you don't check if the drug is properly stored. It's very bad. You understand? So even if you're having exactly the same symptoms with the person, you still have the right, you still have to contact or reach out to your medical, you know, professional around you, or somebody that's learned about medications and infections or diseases around you, which are doctors and pharmacists most of the times. You understand? So stop collecting medications from your relatives, from your friends, from your families, because you're having similar symptoms. And some of you are very keen to abusing the smallest things like paracetamol, anti-malaria, antibiotics. You should stop that. It's very dangerous for your health. Paracetamol, if you take it too in large quantity, is going to damage your liver. Trust me, you might not know immediately. It's a gradual process, and in the long run, when you notice, it will be too late for you. You understand? Anti-malaria that you just use anyhow is very bad. Any small headache like this, it's malaria. Yeah, it's malaria. Stop doing that. Conduct a proper test. Let a test be carried out on you to ascertain that it is malaria. You use anti-malaria every single month. Why? Because of small headache. The next thing is anti-malaria. It's very bad. You understand? Conduct a proper test. Let them ascertain that okay, you have malaria parasite in your body system. Then from there, consult a medical practitioner, a doctor, to prescribe the right medication for you, the right anti-malaria for you. You understand? And antibiotics, yes, people are prone to abusing that a lot. But today is not the talk for that. You understand? But stop abusing any drug, even to the smallest multivitamins. You understand? Stop abusing medications. I'm advising you as a pharmacist, as a learned professional, and I've seen a lot of cases, a lot of drug abuse online, offline, you know. So I'm advising you as a friend to stop collecting medications from your friends and families. So thank you. I'll see you on the next episode. Bye.